Coming to anxiety disorders, this is a very broad umbrella. It includes general anxiety disorders, panic disorders, phobias, and social anxiety disorder. Anxiety is a general feeling of discomfort or fear towards something that may happen in the future, as opposed to acute fear, which is usually something which is in front of you. So symptoms of anxiety are of two types. It can be the mental anxiety, that you just have certain thoughts which are related to a certain fears. There can also be physical symptoms of anxiety. So these physical symptoms include an increase in your heartbeat and you feeling this heartbeat, increase in your breathing rate, sweating, tremors, feeling like you're losing control. You may even faint, you may feel like you need to go to the washroom, you may feel like you need to vomit. And these anxiety symptoms may come with respect to very specific certain situations, such as of heights. So these are called phobias. May have fear of certain animals, maybe blood, certain heights, certain places. This may eventually mount, leading to a panic attack. And when a panic attack occurs, usually it then leads to the avoidance of these situations which led to these anxieties. So for example, a person may start avoiding going out to a certain place, may avoid going to people who have, let's say, a dog, may avoid going to hospitals. Coming to general anxiety disorder, here the anxiety is about everyday things. It can be about multiple things. It's something called free-floating anxiety. The person feels almost restless, on edge, almost throughout the day, worrying about multiple things. Coming to social anxiety disorder, this usually occurs as an anxiety to situations where the person feels they are put on the spot, like public speaking or even eating in a restaurant. The treatment for anxiety disorders usually is again combination of medication as well as psychotherapy. The medication involves drugs which increase serotonin levels in the brain, such as escitalopram, fluoxetine, SSRIs. You may also be given a short-term course of benzodiazepines. Psychotherapy for anxiety disorders involves exposure to these fearful stimuli, so that the brain and the person can understand that the imagined consequences are often far worse than what actually happens in reality. This exposure is usually tiered. Hierarchical list is formed of things that the person is least afraid of to the most afraid of, and the person along with the therapist is walked through these multiple steps, finally leading to exposure to the actual imagined fear. For example, if a person is afraid of dogs, the hierarchy may involve something like initially talking about a dog, describing it, then looking at pictures of dogs, videos of dogs, seeing a dog in person but far away, let's say across the street, then maybe being in the same room as a dog, maybe going near the dog but not touching it, eventually touching the dog. So this is just an example of how a hierarchy can be made for something that you fear. Another type of treatment is called imaginal exposure. This is useful in those situations where a person may not really be able to physically confront their actual fears. The other treatment is imaginal exposure. Imaginal exposure is done when the actual imagined fear is probably far too dangerous to bring into the clinic, or as a preparation for exposing them to the real object, where a person imagines themselves being in an anxiety-inducing environment with these anxiety-inducing objects before actually being confronted by these objects in situations. And again, treatment for anxiety disorders is not lifelong. It's usually for a few months to a year, maybe 2 years. Another type of anxiety disorder is called illness anxiety disorder, where a person feels or believes there is something terribly wrong with them. They may be having some major illness like cancer, and none of the doctors are able to diagnose them. They may feel this, go to multiple hospitals, get multiple investigations, spend lakhs and lakhs, but their anxiety and their belief that they're having something which everybody is missing is the prominent symptom in this disorder. Now coming to substance use disorders or addictions. So addictions also have certain criteria which need to be met to call them addictions. Just taking tobacco, smoking, chewing on them, or drinking alcohol doesn't necessarily mean a person is addicted. So addictions are characterized by a use of, let's say, any of these alcohol or tobacco for longer times than initially intended. If the amount of substance consumed has progressively increased, if there is a lot of craving for these substances, that is when the person is doing something else, they are thinking about these substances and thinking about the feeling that these substances produce. A lot of time goes into either procuring these substances or recovering from their effects. The substances are being used in situations which is inappropriate for them, such as drinking and driving. If these substances are being used even after major health scares, if the person knows that these are physically hazardous to them but cannot stop using them, if these substances have started interfering with their social and occupational and even physical and mental well-being. Other symptoms also involve a decrease in the number of things the person enjoys in life. All the enjoyment may be restricted to just these substances, and other things such as family, their hobbies may take a backseat. Persons also typically express what is called as withdrawal symptoms. They may start experiencing, let's say, if they are not getting alcohol for a night after having had alcohol for many days, they may start developing restlessness, tremors, increase in their heartbeat, breathlessness, sweating. They may feel like they need to vomit. They may start hearing voices and become confused. With substance use disorders, most people may present to a psychiatrist either in the withdrawal phase or when the habit has gone out of control and they desire to quit. So treatment again here is a combination of medication, especially in the withdrawal phase, and once the person has stabilized, they may want to spend some time either at home or at a de-addiction center where there is multiple sessions with a psychotherapist or psychiatrist where they discuss certain strategies to overcome addictions. And these changes involve changes in their environment, in their thinking patterns, in the way they relate to these substances, why they are taking, how they can replace them with other more useful ways of getting that dopamine hit. And also focusing on relapse prevention. Relapse prevention also can be both pharmacological as well as psychotherapeutic. So these are some of the common adult psychiatric conditions. Of course, there are conditions which occur in children such as autism, conditions which occur in the elderly such as dementias, and also general personality disorders. So psychiatry is pretty broad, and I hope from this video you got a basic understanding of some of these disorders and how they are treated. I'm sure if you have more doubts, you can drop them in the comments. We'll get back to you. You can follow our social media pages or come down to one of our clinics if you feel you may be experiencing certain symptoms and if you require a detailed evaluation and management.